Barbara's handling the billing. That will also tie into the chronic care management because the billing aspect on that too. And Greg is caught up to speed with this, but please, ask any questions you need in terms of what we want to focus on here, okay? And I'm going to transfer you now, and then we'll touch base right when the demonstration is completed, okay?
Okay, sounds good.
All right.
Okay, we also have
this is Greg
Cecilia
Tucko with
here.
NextGen office. How are we today?
Good, how are you?
Good. So we have William and Barbara, correct?
And also we have Cecilia. She's the office
Okay.
manager. Barbara is the billing person, and
Okay.
I'm tech, my IT guy, sort of.
Perfect. So William, Barbara, and you said Cecilia?
Cecilia.
Cecilia, got it. Awesome. Well, it's nice to meet everybody. So my name is Greg Toko. I'll be doing the demonstration. I went ahead and activated my screen a few seconds ago. You should be able to see with my mouse moving. Is that correct?
Yeah, I see your screen.
Perfect. So kind of as we're going through the demonstration, we want to make this as interactive as possible. So, I'll do a good job of pausing and seeing if you have any questions. But as we're going through the demonstration, if something catches your eye, definitely bring it to my attention. If you want to see something again or if you think I missed something, definitely let me know, okay?
Okay. One question. We have like some controls on the screen, so we can't see a large image of your screen. How do I just make your screen huge?
You should be able to, if there's any X's or any drop downs, you should be able to get rid of those. If that doesn't work, I can also make my screen bigger as well.
Okay, I think we found something.
Okay, and let me know. Do you want me to zoom in?
Yeah, please.
Sure, no problem. Alrighty. That should be a little bit better, hopefully.
Yeah, that's good.
Perfect. So from my understanding, the specialty of the practice is endocrinology. And how many providers are there in the practice?
Just one.
Okay, perfect. And then I know Luke mentioned that you are possibly looking into doing chronic care management billing. Is that correct as well?
Right.
Okay, perfect. So we do have a CCM module built in. It's going to go ahead and pick up all the patients that qualify for that in a neat, clean-looking dashboard, and you can go ahead and send the claims directly out of our system. So kind of the flow of the demo, we would do patient registration. We can touch on scheduling, check in a patient if you'd like. We do have a patient portal. We can spend a few minutes on that as well if that's something that you're looking into. And then we can spend a lot of the time on the EHR side and then wrap things up on the billing.
Okay.
I know with Barbara being present, she's the biller. Do you want me to kind of spend a good amount of time on the billing side or more on the EHR side? What are your thoughts?
What do you want more, Cecilia? Do you want more of the billing or more of the EHR?
So we have EHR and billing all
Yeah.
together.
And they have CCM too.
Okay. Can you go into the billing?
Sure. So I'll focus, obviously we can set up second demonstrations down the road to kind of focus on what's more important for the audience on the demo. So I'll kind of do a high level of front office and EHR and then kind of spend most of the time on the billing side. Does that sound good?
Okay.
Perfect. As far as accessing the system, we are fully cloud-based, so pretty much as long as you have internet connection, you're good to go. So desktop, laptop, Mac, PC, not a problem. On the EHR side, you can even do your charting on an iPad or a tablet. And then, like I mentioned, we have a patient portal that's accessible on a smartphone as well. And then as far as what you're looking at currently, this is the practice management side. You have your patient roster, scheduling, billing, real-time, and reports, and then the EHR clinical side is listed right here. So let's go ahead and get started with patient registration. As far as your patient mix, are you strictly insurance? Do you have any self-pay sprinkled in there? How does that look?
Yeah, both.
Both, perfect.
Yeah.
So we'll go ahead and register a self-pay patient, and then we have a pretty unique functionality in our system where we can actually run a real-time eligibility response and create a chart directly from that response. So let's go ahead and register a self-pay patient first. So what I'm going to do is I'm going to hover over the Patients tab, and I'm going to hit Register a New Patient. It's pretty straightforward. You would just go ahead and fill out the demographic information. The fields in yellow are mandatory. You hit Save Changes in the charts created. So that's for your self-pay patients. Now for your insurance patients, like I mentioned, we can actually come up to the Real-Time tab, and we can run an eligibility request and create a chart directly from that response to make sure that there's accuracy in the billing. So for that option, what I'm going to do is you would just go ahead and select the payer in the drop-down. You put in the patient's member information, and then you hit Submit Transaction. So we are our own clearinghouse. I'm not sure if Luke mentioned that. So what's going to happen is with that direct clearinghouse connection, in about 2 to 4 seconds, we're going to get a response directly from the insurance company, and I have one on my next screen. So here you'll see me as a patient. You'll see that I have active coverage. You'll get copay amounts listed right here. Then on the far right side, you'll get more detailed information, such as in and out of network benefits, co-insurance, even deductible, or what's remaining for the year. Now, the unique portion is that we can go ahead and hit Create Chart. So what this is going to do is this is going to send us back into the demographic screen, and it's going to autofill everything from the insurance company as far as, the patient name, the date of birth, and all the insurance information, directly how the payer has it in their system. So the importance of this to kind of highlight a scenario for you is, let's say for sake of example, I came into the practice and I gave you my name as Greg. However, the insurance company has it as Gregory. If you try to submit it with that incorrect information, that could cause a claim to deny. It could cause it to reject. Next thing you know, Barbara's having sleepless nights with all these delayed payments. The AR's a mess. All the associated headaches that come along with that. So we want to make sure we get it right the first time, exactly how the insurance has it on file. Take a quick pause. Any questions, comments on that piece?
No, straightforward.
All right.
Yeah.
Since we're on the screen, we'll go over appointment reminders. No-shows and cancellations can absolutely cripple a practice, so we want to kind of minimize that as much as possible. So patients can get sent email notifications. They can also get sent text messages. We also integrate with a third party that can do phone calls. You set the schedule and frequency of those, and the system takes care of the rest, and you can be as proactive as you want with your appointment reminders.
Okay.
So now we have a patient in the
So
system.
there's
Let's touch on
no fee for the email or text message, right? Reminders?
The email is free. The text messages is normally about $10 a month.
Oh, okay.
And Luke can kind of iron that out in a little more detail as far as, pricing and discounts and stuff like that.
Is this,
But, the hope is that, by using that $10 a month text message option, if you get one patient to show up for their appointment via that text message reminder, that right there is going to pay for itself.
Yeah.
So you do not make a phone call?
It's an outside
the-
company, he said.
We can do that. It's through a third party. We don't charge anything for that setup.
Yeah,
Dr. Dial is the company that we use. They do charge something to use it.
okay.
Any other questions on the reminders section?
No.
Okay, perfect. So from here, we'll touch on our scheduling module. So I'm going to hover over the Schedule tab. There's a few different views. Let's look at our day view first. You'll have different colors for different appointment types. This is fully customizable. Go ahead and name it anything you want and assign it any color in the color spectrum. Option number 2 is going to be our week view. It's going to be the same color scheme, different colors, different appointment types. Now to create an appointment, you just go ahead and select the time. From here, I just hit the drop down for my appointment type. Let's just say it's an established patient, 15 minutes. Put in any notes or reasons for the appointment, and then we hit save. So now we have an appointment. We'll kind of go over flexibility in the scheduling module. We actually have drag and drop functionality, which is kind of nice. So just for sake of example, let's say I had an 8:30 appointment. Maybe I'm running a little bit late. I got a flat tire. From a workflow standpoint, we want to make sure that you're staying on one screen as long as possible. So what you can do is you can actually just go ahead and grab the appointment and do a drag and drop to my new time like that. Or maybe I needed to reschedule for a different day, no problem. Drag it over to maybe Friday. Or let's say I needed to reschedule for the following week. No issues there. What I can do is I can grab the appointment, put it on my clipboard right here. You'll see the appointments attached to the clipboard. I'm going to open up my calendar, go into next week in October, and bring me down like that. Any questions on scheduling or calendar?
No.
Nope. All right, fantastic.
That's good.
Lastly, as far as the schedule, is going to be a more traditional daily schedule. You're not going to have drag and drop functionalities on this one. Let me get some good data to work with. One second. There we go. Perfect. You're not going to have drag and drop functionalities on this, but you'll be able to see the notes and the reasons for the patient's appointment. The status is going to refer to a few different things. If the patient confirmed the appointment via the text, email, or phone call, the status would change to confirmed. And then when the patient gets checked in or checked out, it'll update the status. It'll also timestamp it as well, which can be reported on. The last piece of the puzzle are these different colored circles right here. So what those represent is that's eligibility checks being run attached to the appointment. So it's one thing making sure that the patient's active and good to go when the chart's created. It's a totally separate animal making sure that this is done on an ongoing basis. So you're not going to have to call the patients the day before the appointment, confirm it, make sure their insurance doesn't change. Let the system kind of do that administrative heavy lifting for you.
So the system does it automatically, like the day before or something?
You set the schedule on those. So you can do it 2 days before, 3 days before, 5 days before. You can also differentiate it by payer. But yes, the system will go ahead
And it's
do it for
automatic,
you.
though.
Exactly.
Wow.
So how important is eligibility? How important is eligibility to you in your practice currently?
Screen.
I'm sorry, what was that?
Like, is eligibility checking important in your practice?
Yes,
Yeah.
we have to check.
Yeah, we have to-
daily,
Yep.
on a daily basis.
Exactly. And we don't. I'll paint you another story. And when I was fresh out of college many years ago, I took a volunteer position at a pediatric practice. And because I was green and I was a volunteer, I was willing to do anything. So I got the task, or the unfortunate task, if I may, of this was before EMRs were really prevalent, where I would print out the schedule for the next day, and I had to call every single patient on that schedule. I had to confirm the appointment, and I had to make sure that there were no changes to their insurance.
Mm-hmm.
If there were changes to their insurance, I had to then call the insurance company and make sure that the insurance that they gave me on the phone was active and good to go and no issues. And that right there can really eat up a lot of your day. So, it's all about letting the system kind of do, like I mentioned, that administrative heavy lifting for you. And then, from the eligibility piece, there is some action needing to be done by the practice. So what you would need to do is you come into your eligibility work list right here, and you would want to look at this on like a proactive basis.
Mm-hmm.
So let me go ahead and pull up an account. Perfect. So here we have our active patients for the day. You'll see that this is for a future date. And then we have our one inactive patient right here, Mary Tyler. So
Okay.
someone would need to reach out to Mary. They get her on the phone. I am so sorry. I forgot to let you know. I switched insurance companies a month ago. I'm on my husband's plan. No problem, Mary. Can we get your updated information? Of course. She gives you the updated information. So that way all the patients are going to be in that green active status for the day. The last thing we want, and I've seen this frequently in the healthcare industry, is for Mary to come in for her appointment thinking that she's active and good to go. Well, the eligibility wasn't checked. Maybe it gets checked while she's in the waiting room. Turns out she comes up as inactive.
Mm-hmm.
Well, so what's the next step? Someone has to get on the phone with the insurance company, with her new carrier, confirm the eligibility. That can take 5, 10, 15, 20 minutes. The phone tree for insurance companies can be quite adventurous, if I may. So in order to speak to a live person to confirm the eligibility, that can take a good amount of time. Meanwhile, Mary's sitting in the waiting room trying to get this all sorted out, and by the time she actually gets seen by the doctor in the exam room, she might not be in the best mood because she's been there for 30 minutes. So you'll notice that, from the patient registration to the scheduling, and then even patient portal, EHR, into billing, we have a lot of kind of checks and balances in place to really enhance the patient experience and ensure that there's a smooth flow from one section to the other. So that was the eligibility work list. Any questions on that?
Nope.
No, sounds good.
Yeah.
All right,
that's
fantastic. So from here, I can spend just a few minutes on the patient portal if you'd like. Do you guys use a portal currently?
We do. Yeah. It's
Okay.
not that our patients don't really go to it very often, but we do have one.
Do you want me to show it to you visually, or maybe hold that for another time?
We could do that another time.
Okay,
Yeah.
perfect. So what we'll do is we'll head over to the EHR, and then we'll go ahead and spend the rest of the time on the billing side. Does
Okay.
that sound good?
Yep.
Perfect. So let me go ahead and switch accounts real quick. I'm going to get to my endocrine account to give us some good EHR information. So what we're going to do is we're going to head over to the EHR. So now this is the EHR side. You can also make this your dashboard or your landing page for the clinical team. So that way when they log in, this is the page that they get directed to. And then from here, you have your list of appointments for the day. So as far as your workflow, is it safe to assume you have like a medical assistant or triage nurse that takes the patient back, puts them in a room, and then takes vitals?
Yep.
Perfect. So what he or she would do is they're going to go ahead and select the time. So what we're doing is we're creating the encounter and attaching it to the scheduled appointment. So now we're in our SOAP note. You'll see it's illuminated on the left-hand side. And something that probably caught your eye is that the EHR side does look very different from the practice management side, and this was done on purpose. It's kind of built out through these rectangular tabs. So like I mentioned on the intro, this can be accessible on an iPad or a tablet, and that's kind of how our system's built. So you can go ahead and move from room to room, carrying that mobile device, and kind of tap your way through the system to get the data output. Now, you're not limited to just, the rectangular boxes. If your providers or clinical team wanted to do any free typing or dictating, you can absolutely go ahead and do so. So in each section of the encounter, you're going to have this little piece of paper. This is going to be your dedicated notes section. So what you can do is you can open it up, go ahead and do any free typing. You can even dictate it to this section as well, and you'll get that output with the timestamp. So
You're saying you have voice dictation instead of typing?
You can.
And
So
it's integrated in already? Or?
So it's not necessarily an integration. So you can use any dictation systems, Dragon Medical,
yeah.
Modal. If you're going to be using a newer Apple product, they do have dictation built in, which is free of charge, and that just comes with the device that you're purchasing.
Oh, okay.
So let's go ahead and work on chief complaint. So I'm going to come into my endocrine tab. From here, you'll get a variety of different sub-options. This is built specifically for the practice, and we'll absolutely go ahead and import what we have based off your specialty. And I kind of, as a preface before we even kind of dive into the SOAP note, everything that you see in the system is customizable. So you'll see a variety of questions, you'll see a variety of drop-downs, a variety of possible entries. That's all fully customizable based off your clinical preference. So let's just say the patient's coming in for an enlarged thyroid. I'm going to go ahead and select it. From here, I get this custom questionnaire. Now, I know we didn't show it to you on this demo, but on the patient portal, we do have an appointment check-in where the patient or the patient's family member or a proxy can actually go ahead and fill this out as part of the appointment check-in process. And then the medical assistant or nurse would just go ahead and save it and have it flow into the note. So I'm just going to run through a few questions right now just to kind of show you how it looks. So, Mr. Cooper, how long have you had an enlarged thyroid? 1 to 3 months. Noticed any swelling in your neck? Yes. Having pain? Yes. 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 You'll notice just by doing some tapping, I'm going to go ahead and hit save just to give you a sample output. And here we have our output right here. So once again, a few different options, a lot of flexibility. You can put it into paragraph format, almost like you typed or dictated it.
Oh, so it types it on kind of on its own. You don't have to sit and type all that.
Exactly. It's kind of from an engineering standpoint, it's pretty spectacular, if I may use such a robust word. I'm not a computer engineer, but to see how, you get that tap method in this narrative format, it's pretty impressive from an engineering standpoint. Now, you're not just limited to just the paragraph format. If I hit the drop-down, you can go ahead and change it into sentence structure. Just got to kind of list it out line by line. And then last but not least, you have original format, which is going to really break out the different HPI elements.
Okay.
Any questions on chief complaint?
No. Unfortunately, only the billing person left here, but it's being recorded, so.
Okay, perfect. I will touch on vital signs real quick, and I'm just going to breeze through the EHR. I know we're going to focus on the billing, but just kind of want to show you how it looks in the field.
Okay.
So from here, I'm just going to enter vitals, blood pressure, pulse, respirations, temperature. If I go into additional information, we have an automatic BMI calculator, and then from here, you can just go ahead and put them in a room.
Okay.
Other components of the subjective, I do want to touch on medication history. What we can do is we can actually reach out to the pharmacy's database, and we can actually import any previously prescribed medications. as long as they're on the pharmacy's database or processed through insurance. So
Okay, even if it's
that-
not from this physician, even if it's from any of their other physicians?
Correct, and that is pretty much the sole purpose
Mm-hmm.
of that functionality.
Right.
So I'm sure when you have new patients come in, you tell them to bring their list of
Yep.
medications or even bring in the bottles. Well, people aren't perfect. Maybe
Mhm.
they'll forget or they won't remember them with 100% accuracy. And, that really, even though it should be on the patient to kind of provide that information, we should, as an EMR system, be able to get that information into the system.
Yep.
So what we can do is we can go ahead and pull from their RX history, and it's going to automatically add the medication for you. Now,
Okay.
once it's added, you do want to do a medication reconciliation. Mr. Cooper, are you still taking Synthroid? No, I've completed it. Mark it completed. Are you taking ibuprofen? No, I've completed it. Kind of like that.
Okay.
Any questions
And that's
on
something
that?
they could still do in triage, right? They would do that there?
Yes.
Okay.
So probably right now, because we're still in the subjective, this is still being done by the medical assistant.
Yeah.
Doesn't necessarily have to be. The login is more or less going to be the same as far as the medical assistant or the doctor.
Okay.
But yeah, normally the subjective tends to be filled out by the medical assistant or triage.
Okay.
Now, keep in mind, this all could have been filled out by the patient during the check-in process to really make that patient intake a lot quicker and really smoothly flow from one section to another.
Mm-hmm.
Any other questions on subjective?
Nope.
Okay. So from here, I'll just touch on physical exam briefly. You can go ahead and do any typing or dictating, or you can use the touch buttons down here. I'll just run through one briefly. Just to show you how it works, I'm going to come into constitutional first. From here, you'll have a few different colored phrases. We have a default negative. The patient is awake, alert, well-developed, well-nourished, and well-groomed. Let's say no issues there. Say inspection of the head, no issues there. So this is going to go ahead and appear. Now let's say you're doing an inspection of the neck and the patient's coming in for that enlarged thyroid. So I come into my neck phrase. I come into thyroid. Then we have these two different colored phrases. But for this one, I'm going to tap on my unreviewed phrase. And then from here, I'm going to go ahead and kind of tap to note my positive findings. So that's going to flag in red, and you'll get that sentence output.
Okay.
Any questions on that?
Nope.
Okay. And then another nice functionality, I don't know if you need to use it or not, but I'll just demonstrate it to you. We do have the capability to go ahead and upload images. So if I select a body system, we have a library of images which you can go ahead and use and mark up. Or if you're using an iPad or a tablet, if you hit upload patient image and hit browse, it's going to drop it into the patient images section where you can actually take a picture of the patient's affected area, go ahead and mark it up, do any typing or dictating, and you'll get the output like that. Questions on that section?
Nope.
All right. So next section is going to be assessment. This is where we diagnose the patient. So we can go ahead and suggest a panel of codes based off the patient's chief complaint. I'm just going to pick a few just to get some data. You'll have your favorites panel set up in ABC order. You can pull from the patient's problem list, anything previously diagnosed, and you can even do a quick search right here. Any questions on the diagnosis section?
Nope.
All righty. So we'll go ahead and wrap up the note with the plan. I'll start off with orders. If you need to send out any people to do any lab work, which I'm sure you would do based off your specialty, you need to set up with a bidirectional interface, LabCorp, Quest, whatever it may be. How that works is you create the order in the system. It gets sent out electronically. From there, that result comes back in, and then you can map those in what's called a flow sheet over time to visually note the patient's progress.
Sorry, I missed that last part. Wait, you can send it electronically, then the results will also come back electronically.
Yes.
Correct.
And then you can map them in a flow sheet over time to visually note the patient's progress.
Okay.
If you need to do any imaging, we can create radiology orders. If you need to send someone out to a further specialist for whatever reason, you have your consult module.
Okay.
And then from here, we'll go to P-prescribe. So keep in mind, we've already done the medication import, so we're fully aware of what they're currently taking. From here, I can come into my new medication. I'll have my favorites panel set up for the provider. Go ahead and select the medication. Now we do have a formulary checker built in where if there are any lower tier or generic versions, we'll go ahead and let you know to save the patient money. You then have your favorite SIGs down below. From here I can hit save and e-prescribe. This is your verification page. Just confirm the default pharmacy on the lower right. If everything else looks good, you hit transmit and then medication's off to the pharmacy.
Okay, and does this connect with their insurance to make sure the medication's covered and everything, or is that separate?
Yes. No, it'll also scrub that as well.
It does do that. Okay.
Yes.
Because that's a big thing.
And yeah, of course. And then does the doctor prescribe any controlled substances?
Yes.
Okay.
Well, she
So
can.
he can.
Not that often, but she can.
Okay. Well, what she can print them out, or she can send them out electronically. If she wanted to send them out electronically, pretty much the only real difference is there would be a pop-up window right around here where she would get a 6-digit passcode delivered to like her cell phone or like a keychain token or fob. From there, you input that passcode and the medication gets sent to the pharmacy.
Okay.
And then, does she prescribe any medications that need prior authorizations?
Sometimes, yeah.
Sometimes. How's that being handled currently?
Well, there's somebody here that gets the prior auth from the insurance
Okay.
that contacts them and gets it.
Is it done like via telephone?
Yes.
Okay. So we have a brand new integration. It should be coming out, I think, January 1st. So by the time you were to get up and running.
Right.
But is it will actually go ahead and scrub that medication and let you know if a prior auth may or may not be needed.
Okay.
If a prior auth is needed, you can actually go ahead and submit the insurance-specific forms directly to the payer.
Oh, great.
Yep. So no need to stay on the phone with the insurance companies. Just kind of submit the forms directly, and that's free of charge built into the system.
Okay.
And then kind of wrapping up the note, follow-up section, we have customizable care plan and the customizable patient instructions. With patient instructions, we have a few different integrations, which are nice. We have an integration with a company called Elsevier, where based off the diagnosis, we can actually go ahead and suggest patient instructions. You can go ahead and display these on the patient portal. You can also go ahead and print these out, give them to the patient as well.
Okay. Nice.
And then last but not least, Barbara, this is kind of where you start coming into play a little bit, or this is kind of where the EHR transfers into the billing. We have our procedure coding section. Now you'll have your favorites panel set up down below, or we even have E&M coding assist built into the system, where if you give us a complexity from minimal to high, we can actually go ahead and suggest a level for you based off the documentation in the encounter.
Okay.
So now what we're going to do is we're going to go ahead and add our diagnosis codes. We hit generate PM billing. What that's going to do is that's going to generate a user hold claim. A user hold just means for billing review, and we'll touch on that in a few minutes.
Okay.
So that was a note from scratch. We can go ahead and create templates. You can also go ahead and import patient's prior encounter. I'm going to save that for a future time if that's okay, just to kind of focus more on the billing.
Sure.
Is that okay with you?
Yeah, that's good.
Perfect. So what I'm going to do now is I'm going to go ahead and switch accounts. We're going to touch on document management and then touch on the CCM billing piece. So we're going to go back into the EHR as if we never left off. So we'll touch on document management first. I'm going to come to documents at the very bottom. We have single file upload. You can scan into the system. And then we have a bidirectional fax. And then we also have this section called document library. So this is where you can go ahead and create your own custom document template. So it's really nice functionality. Any return to work, return to school, sick notes, consent forms. I'm sure you get a lot of referrals from primary care providers. What you can do is you can go ahead and create a custom document template and send letters back to them. So that's going to be like a consultation letter right here.
Right.
So just to kind of show you how one looks, you'll notice on the left-hand side we have these blocks. So these are called content blocks. So what would happen is you go ahead and create the encounter, and you're going to go ahead and attach it to the document, and it's going to go ahead and pull all this information automatically
Just
for
fill
you.
it. Okay. Right.
Now, where these blocks came from is we have this little pop-out on the left-hand side. So what you would do is you would start typing your document, and you just go ahead and bring things over from the left side to the right side, kind of like that.
Okay.
Any questions on that piece?
No.
I'll touch on CCM billing, and then we'll go ahead, and that should leave us about 25 minutes for the billing side.
Okay.
So I'm going to come into my report section right here. So here we have our CCM billing module. So it's pretty straightforward. You would just need to go ahead and, have the patient accept the fact that they're going to do CCM billing, and I'll show you where that pulls from on the patient chart side. They have to sign a document that says that they allow for CCM billing to be performed on them. And that's pretty much it as far as the patient side. On the actual clinical documentation side, the patient just has to have 2 chronic conditions, and there needs to be recent activity in that month time span.
Mm-hmm.
Pretty much other than that, the system's going to take care of the rest for you. So what's going to happen is it's going to go ahead and pull your list of patients that have those 2 chronic conditions,
Mm-hmm.
and then that have that recent activity. Now, from here, it's pretty straightforward. You just go ahead and select that button right there. You hit Create Claim. That's going to go ahead and send that over to the practice management side, once again in that user hold status, so that way you can just give it a quick review, Barbara, and then send it off to the insurance company.
Okay.
Now,
So
what's
for the
also nice
person
is-
that's doing the phone calls and everything, they're able to get a list, correct, of all the patients that qualify and that have accepted
Exactly.
it? Okay.
Yeah, so that's what the ready to bill is. So the ready to bill is,
Ah.
on the patient chart, that you have that recent activity. But taking it a step further, if there isn't any recent activity, it would go ahead and populate right here. So here you
Okay.
have patients with 2 chronic conditions, but there isn't any recent activity. And then taking it a step further, just to make sure every patient's accounted for and nothing's being left out, it'll also give you a list of fee-for-service patients that do not have permissions selected on the patient chart.
Okay.
Any questions on that? Does that make sense?
Yeah. Yep.
Okay. So it's a pretty smooth workflow, pretty nice dashboard, and from a CCM revenue standpoint, there's definitely a lot of money to be had. But not
Mhm.
only that, from a patient care standpoint,
Right.
it's important that, especially with patients with multiple chronic conditions, that they're being addressed accordingly.
Yeah, definitely.
So from here, I think that was pretty much everything I had on the EHR side. Obviously, I can go in a little more in depth at a later demo. We'll spend the rest of the time on the practice management side. I'll take a quick stop. Any questions, comments, feedback, anything you think I've missed? Any second looks?
No, I don't. Everything's good. Yep.
Perfect.
So far, so good.
So I'm going to go to the practice management side. It's at the very bottom. So this takes us back into our home screen. So first and foremost, we'll show you where those claims end up on the practice management side to be billed. We'll touch on patient chart. I'll show you where to document, their CCM permission, rejected claims, payment posting, and then managing AR, and then close it out with reports.
Okay.
So if you remember, someone hit generate PM billing on the EHR side. Obviously, we need to kind of close the loop. Where do those claims end up? So I'm going to come over to my billing tab, and I'm going to go into my managed claims dashboard. So like I mentioned, they're going to be in that user hold status. So they've been created but not sent off to insurance company. Obviously, we want Barbara to kind of give it a second look before it gets sent out. So you'll notice here's all the information needed to go ahead and bill that claim. I can go ahead and check that one off and then hit submit. Or what we can do is we can go ahead and go from top to bottom. You'll notice as I'm going down, the information on the right-hand side is changing. We can go ahead and select them all and then do a batch submit. Now, like I mentioned, with the real-time, we are our own clearinghouse. So what that means is when you hit submit, it's going to go through a series of edits and scrubs, go through billing rules, billing guidelines, make sure everything's filled out appropriately. If there were any issues with the claim, it would very clearly state on screen in real time for you, Barbara, to make the necessary changes. We then batch out our claims daily to the insurance company.
Okay.
Any questions on that piece?
Anything? No.
Okay, perfect. So I'll touch on rejected claims, and then we'll look at patient chart and then payment posting. So there's a few different options. For rejected claims, I like to look at my claim status dashboard. I can come into my rejected tab and go ahead and look at this amount. So So once again, with that direct clearinghouse integration, we'll get responses from the insurance company as to why the claim was rejected. So these are all test patients, so they're going to get rejected for eligibility. And then taking it a step further, Barbara, you'll appreciate this. We actually include the payer's claim number, which is the ICN, DCN on screen.
Mm-hmm.
So that way you can very easily retrieve that information. You know, 9 times
Right.
out of 10 when you're on the phone with the insurance company, they don't care what our assigned claim number is. They
Right.
care what their assigned claim number is. So instead of having to, dig through all your
Find
papers,
it.
you can very clearly state it right here.
Okay.
Now, let's say you're on the phone with the insurance company. You wanted to go ahead and document your conversation. We have a notes section on the screen. It'll timestamp it and let you know which user put in that note. And then when you need to make any changes, just go ahead and edit the claim and then send it off to the insurance company.
Okay.
Any questions on that section?
Nope.
All right. So as far as patient chart, I'll show you how to get there, and then we'll take a look at it. You'll have these search parameters on the upper right. You can search by these patient parameters. You can also search by claim number. If I hover over the Patients tab, you'll have your patient roster. You'll have your recent patients right here. I really like this one. This is going to have your last 10 patients that have been viewed by you. And then I'm going to go into a patient chart. So from here, you can upload their photo. You'll have their demographics listed right here. Here's their insurance information. You'll notice you can push verify eligibility directly from this screen. Here's their ledger as far as what's owed, list of appointments, statements, any messages or authorization. So I do want to touch on the messages section. If I come into here, this is where you can go ahead and create your chart notes, or we have a section for alerts. So this is kind of a nice functionality where you can alert on scheduling or billing. This is kind of informal communication. Maybe they have a nickname that they preferred. Maybe they're a fan of a particular sports team. Maybe they owe deductibles. Maybe they're a no-shower frequently. That kind of stuff. Just ways to kind of communicate to your front office scheduling staff, or even you, Barbara, for the billing, certain pieces of information.
Okay.
Any questions on patient chart?
Nope.
So just to kind of touch back on the CCM permission, I'm going to come into my insurance information section. So I'm going to go ahead and edit this insurance profile. So in order for that patient to be picked up for the CCM program, they need to be Medicare fee-for-service. And then you'll notice right here, this is how we get that CCM permission so that it appears on the EHR side. So you would just have to hit yes, select the rendering provider, and then as far as, uploading that document and attaching it to the patient's chart, we have a document section on the practice management side as well, where you can upload it or scan it. You'll notice right here we have a document type, chronic care permission.
Okay.
Any questions on that?
Nope.
Nope. Alrighty. So from here, we'll touch on payment posting. Are you familiar with ERA auto posting?
We do have that now. I'm not sure if it's the same as yours, but
Okay.
yeah.
So pretty much with ERAs, instead of having to manually post everything in the system via like a paper check, we can get ERAs in the system and have the system auto post them. Which is
Right.
save you a lot of time and make your job a lot easier. So if I come over to my billing tab, I'm going to come over to my ERA section. So here we have around $1,100 from the insurance company. Go ahead and select the date. So this brings us into our ERA screen. So at a glance, you'll be able to see the charges, what the patient owes, what the insurance paid. Now, taking it a step further, we actually have a PDF of the patient's EOB directly from the insurance company. You'll be able to see this is a CO45 contractual adjustment. This is a PR2 coinsurance. If everything looks good, we can go ahead and check that one off and then queue it for auto post. Or what you could do is you can go ahead and check them all off and then queue it for auto post.
Okay.
So what's going to happen is in about 10 to 20 seconds, depending on the size of the ERA, it's going to go ahead and post the patient responsibility, the insurance payment, and the adjustments for you automatically.
Okay.
Any questions on
I
that?
mean, it's pretty
Patient
much
by
the
patient?
same. No, it's not patient. It's by check. You just post the whole check all at once. You don't get to look
Yeah, but
individually.
he's saying you to
Yeah, here you
individually.
can look. You can, but you don't have
You
to.
don't have to, okay.
Yeah. Yeah, right now we just do it by check. We don't get a list of all the patients.
Really? So you just
yeah.
it just blindly auto posts everything?
Yeah, but then at the end you get a report and it lets you know, all the denials and the things that couldn't post.
So it kind of do you have to like work backwards almost?
Yeah, pretty much. Yeah.
This is much
Sometimes you even have to reverse things because, long story,
Oh, sounds
because of
awful.
copays and
Yeah,
things.
we'll say that for another time.
Yeah.
You know, it's all about financial checks and balances and getting things right the first time. So we,
Yeah.
we do have the queue for auto post, but another functionality, and this is probably my preferred method, is we have a queue for auto post with unpaid lines appeal. So it's all about financial control and making sure
Interesting.
everything's accounted for.
I prefer
So
this.
what this one will do is this takes it a step further.
Uh-huh.
So just to paint a scenario for you, let's say you submitted a claim with 3 service lines, 2 of them get paid, one
Right.
of them doesn't. You know, let's go ahead and post those 2 paid lines, no issues there.
Right.
However, that one unpaid line, it's going to go ahead and flag it and put it in an appealed status to make sure that you can go ahead and work that at a later time.
That's great. And it's automatic. See,
Yeah.
Automatic.
the only way we get it now is I have to go and figure out what it's aging on there. We don't
So
get
work
like a
backwards,
set
right?
report to look at. Nice.
Yeah.
Yeah, and, you know, it's all about, like I mentioned, it's all about that smooth flow from one section to the other. And, at the center of that is the patient. The last thing we want is for patient to get a statement that has incorrect information. Next thing you know, she's calling, speaking to you, Barbara, what the heck's going on? This doesn't make any sense. Well, maybe there was an error in the posting, in the system that kind of led to this.
Right.
We also have a separate denied and zero tab, so it's going to go ahead and parse everything where the whole claim was denied or it was zero paid, and then anything that flag would go ahead and fall into this section as well.
Okay.
So that was auto posting. Any questions on that?
Nope.
So from here, do you guys send out secondary claims?
Yes.
Okay, perfect. Let me switch accounts real quick to get us some good data to work with. So I'm going to come into my secondary billing module right here. So once again, the system's pretty intuitive. It's going to go ahead and let you know if there are any if there are any primary claims with a patient balance that may need to be submitted to secondary. You can go ahead and say, I want to go ahead and create secondary claims for those 2 claims. And then if you have instances where Medicare's primary, as I'm sure you're well aware, Medicare will send the information over to the secondary automatically.
Right.
However, you still need to go ahead and create those crossover claims, which you can do so in our system via batch method.
How about if, so Medicare can sends them automatically, but there are a few that are like locals that have to be paper. Would it flag those for us, or?
Yeah, so it will go ahead. So what you would do is it's called payer maintenance. What you would do is you would go ahead and create a paper payer. So that way, when you come in here and you try to, create the secondary, if it was a paper payer, it wouldn't allow it to be submitted electronically.
Okay.
It would simply guide you to print out the claim.
Got it.
But does that address that question?
Yes.
By the way,
Perfect.
do you have a scrubber attached to your?
Sorry, what was that?
Do you have a scrubber attached to your system that can help you with the modifiers and things like that for billing codes?
Yeah.
Oh, you do?
So we do have like an internal scrub built in.
Okay.
And then in addition to that, I can't really run it because I don't really have a claim set up, but I'll show it to you. So if I come into my charge entry screen, we have something called Denial Defender, where it's going to go ahead and optimize the claim. It's going to pretty much be like an added, kind of layer of scrubbing it. And this is kind of where if there's certain modifiers that may be missing or you're using an incorrect modifier, it will go ahead and let you know.
Okay.
Does that address that question at least for now?
Yes.
Yeah.
Perfect. Let me go back into that account. And I know we touched on patient statements. Do you send those out via your current system?
Yeah, we print them and send them out.
Okay, perfect. So coming into my statements module, we can actually go ahead and run all your statements on a schedule and then have them automatically be deposited into your inbox to review. and I'll just run through a quick one right now. So just for sake of example, let's say on the first Monday of every month, I want all patients with the last name from A through G with a minimum balance of $5 to go ahead and get a statement. You can even go ahead and display these on the patient portal if you'd like as well. That first Monday comes, and then it appears on the right-hand side. Then from here, you have your batches. So once again, financial control, you can go ahead and pick and choose which ones you want to send out. Now you can go ahead and hit that go button and have them all print out to a PDF for you. Or if you'd like, we integrate with a third party where if you hit transmit all statements, that third party can actually go ahead and mail them out for you. Normal cost for that's about 68 cents a statement, which is pretty much just for, stamp, postage, ink, and a little bit of labor.
Right.
What was the cost again?
68 cents a statement.
Any questions on statements?
No.
All right, let me go back into my original account, and we'll go ahead and wrap things up. Looking at AR ledgers, pretty straightforward. Here you'll have it broken down by your different aging buckets. I can come into my amount. Here we have it broken down by payer. You can drive in even further, get it broken down by specific claim numbers, so that way everything's accounted for and nothing's missed.
Okay. I have a question related to this.
Sure.
If the reason for the denial is they're looking for medical records, is there a way to then go here and attach the records and submit it to the claim, resubmit
When
it?
you say, is it certificate of medical necessity or just their actual medical record?
They want like we do labs and biopsies, and they usually want to review the records before they pay for all the
Gotcha.
nodules. This is for
So-
AmeriChoice mostly.
Gotcha. Based off electronic claim submission guidelines, there's really no way to submit actual paperwork electronically.
Okay.
Now, with that being said, we do have a section. Let me find it. So under additional info, we have this section called paperwork, where so what you would do is you would go ahead and select the report type. So just for sake of example, a diagnostic report. And then you would call the insurance company, and you're going to ask them how they want it to be received. So let's just say they want it via fax. And then what's going to happen is they're going to give you a control number. So let's just say you're on the phone. They give you control number 12345.
Yeah.
So what you're going to do is put that on the claim, and then on the document, you're going to go ahead and send it out via that transmission method with that control number on it. So that way it gets matched when it hits the payer.
All right. But I would still have to call them then to get that control number. All right.
That's correct. And
All
that's,
right.
that's not really a limitation in our system. That's
Yeah.
a limitation on NC guidelines.
Right.
Now, for certificate of medical necessity, there is a way to submit that electronically, and we are currently implementing that in our system.
Okay.
Do you have to call now?
Well, I just submit it directly onto the website, so I don't have to call because I do that direct. So it still makes
And you
sense to
can
do it
do that
way.
as well if you want to submit directly to the website.
Yeah, I would probably still just do it that way.
Any other questions on that piece?
No.
No.
So I'll touch on claims work list, and then we'll go ahead and wrap it up with reports. So, with reports, obviously it's important to have a robust module, but you can't really do anything with an Excel spreadsheet. You're literally just looking at it and kind of, working from the spreadsheet to the system. So with claims work list, it's an interactive way to work the claims in the system. So how it works is you go ahead and set up the rules, and then the system will go ahead and run the rules engine and then have the claims populate in this module. So looking at some of the rules that I have set up, and you're not limited to this, I have a very broad rule for all claims pending payment. I have one for specific denials, rejected claims, timely filing. If you use an expected fee schedule, you can go ahead and run it on underpayments. And then from here, you have the actual data.
Okay. Can
So-
we add things to that
Absolutely.
list? Okay.
Yeah, absolutely. So just to kind of show you how it works, let me go into a super user account. So if I come into my admin section, here we have claims work list rules. So I can go ahead and hit create new rule. So let's just say I want to do a rule for everything post-payment that's maybe been denied, and I want to do it for specific reason codes. You can go ahead and say, I'm going to bring those over like that, and then do it for specific payers, kind of like that. fully customizable. You can do it via pending payment. Maybe I want to do it for all claims that have been billed for specific insurance companies. You go ahead and add your criteria, so on and so forth.
Okay.
Does that address that question, at least for now?
Yep.
Perfect. And then as far as the actual working of the data itself, like I mentioned, it's interactive. So first and foremost, we have the two different colors. You'll notice that the ones are in red. The reason that they're in red is they're past their assigned follow-up date. So not
Okay.
only is nothing slipping through the cracks, but everything's being worked in a timely manner. Something that can really cripple a practice is, timely filing.
Mm-hmm.
So, we want to make sure that everything's being submitted appropriately, and if there are any issues with the claim, that we have a sufficient module to go ahead and make sure that those claims get reprocessed in a timely manner. So these ones are in red as they're past their assigned follow-up date. The ones in white are still good to go.
Okay.
So we've talked about the color. Now let's talk about the interactive section. If I go ahead and I select it, from here, we're in our actual work list. So I can look at the activity of the claim just to kind of note its progress. You can assign it a risk level and filter the work list that way. And then we have our different work statuses. So for this one, it's still an open status. Let's say we're on the phone with the insurance company the first time, first payer reach out, and I want to go ahead and set up a follow-up for 7 days from now.
Oh,
So
nice.
you're on with the phone with the insurance company. You wanted to go ahead and document your conversation.
Mm-hmm.
From here, you can go ahead and document your conversation directly from the screen, timestamp it, let you know which user put that in. Maybe they give you the information needed to rebuild a claim. Go ahead and edit directly from this screen, make any necessary changes, and then send it out.
Okay.
Any questions on the claims work list?
Nope.
Okay, perfect. So we'll go ahead and wrap things up with reports. So if I hover over reports, you'll see we have two options in the drop-down. We have our reports inbox and then our reports dashboard. So kind of similar to statements, you can actually run all your reports on a schedule, get them customized exactly how you want it to be, and then have them populate into your reports inbox so you're not having to run these reports one by one. So if I come into my dashboard, I hit the type drop-down, you'll see AR data, appointment, demographic, month-end reports, production reports. If you can think of the data set, we can go ahead and report on it. So just for sake of example, I want to run a production report, and I wanted to do procedure code payment performance, just to make sure everything's being paid appropriately. I'm going to go ahead and select my time frame, and I'm going to hit generate. Now, you can filter out the report beforehand to isolate specific data sets, or taking it a step further, like I mentioned, we can go ahead and customize these reports on screen. So here we have our data. I'm not using an expected fee schedule in my account, so these are blank, so I'm going to go ahead and remove these. I come over here to the gear icon. I'm going to go ahead and uncheck the ones that I don't want. It's going to rerun quickly. Perfect. Now let's say we want to take it a step further and we wanted to go ahead and do something to the charge column. So if I hover over charge, you'll see that we got all these Excel functions built into the system. So I'll be honest with you, I'm not very good at Excel. I can sort and filter and sum, and that's about the extent of my knowledge. And nor do you have to be Excel gurus to use the system.
Mm-hmm.
So we have all the formulas built in. So I can come into my aggregate. I can come into my sum. Let the system kind of do the calculations for you. Perfect. So now we have our charge column sum. Now let's say, for sake of example, we have the report looking exactly how we want it to be. We can go ahead and hit Save Bookmark, go ahead and give it a name, and then taking it a step further, like I mentioned, we can put it on a schedule. And you can get very specific with your scheduling. Let's say on the first Monday of every month, I want this report to be run at 7:45. You come in on that first Monday at 8 o'clock. You come into your reports inbox, and the report's going to be there waiting for you.
Okay.
Any questions on that report?
Nope.
Okay. Is there anything in the reports module you specifically wanted me to show you?
Are we already through aging? Yeah, we don't use too many. Aging's the main thing. No,
So like
I don't think
an
so.
aging report?
Yeah, well, wasn't that dashboard that you were showing us?
Well, this is your AR ledgers.
Mm-hmm.
You can get all this data in a report format.
Oh, okay, yeah, sure.
So if I come into here, I come into my accounts receivable. Just first and foremost, I'll show you a roll forward. You want to make sure everything's balancing from one month to the next. So it's going to have your starting AR right here. It's going to have your ending AR, and then all the transactions in between, broken down by payer. From here, you can go ahead and manipulate it however you want, and then put it on a schedule. Or I can just come in, accounts receivable. Let's just say, for sake of example, I wanted to do an AR by payer summary. I'm going to do it for all types. Now you can go ahead and isolate certain amounts. Maybe you just want insurance. Maybe you just want patient, even user hold. From there, I just go ahead and hit generate. Filter beforehand if you'd like as well, or you can go ahead and manipulate it on screen. Once again, here's it broken down by payer. So it's pretty much your AR ledgers just in like an Excel format.
Okay.
And I'm going to show you one more report, and then I think we're good to go. Monthly appointment report, I really like this one. This is where you can kind of get a good pulse on the practice, let you know how many patients have been seen, what type of patients, how many new patients, how many established patients, so on and so forth. So I'm running an appointment analysis grid for the past 60 days. So what we're going to do here is we're going to do a few different combinations. We're going to go ahead and group it by appointment type. We're going to count the number of appointments and then get rid of the detailed rows. So if I hover over appointment type, I'm going to go ahead and group it together. It's going to rerun real quick, get me the data exactly how we want it. Now taking it a step further, we're going to go ahead and come in here and do a count. And then, this is a monthly summary report. We're not going to need 83 pages. We just want to focus on the detailed rows, the summary rows. So from here, I'm going to come into my formula. Where is it? I'm going to come into, there we go, group it, hit exclude detail rows, and it's going to go ahead and give me the summary rows. So we'll get the report looking exactly how we want it to be. This tends to be a popular one for your provider, so that way she can kind of notice how the practice is doing from a monthly standpoint. So for the past 60 days, we've had 1651 appointments, 17 consultations, 545 established, 309 new patients, so on and so forth. Go ahead and put it on a schedule so these can get run automatically, maybe the first of the month. Any questions on that report?
Nope.
All righty. So that's pretty much everything I had, and we hit the top of the hour perfectly. Before I transfer you back over to Luke, any questions, comments, anything that you think I've missed, any second looks?
No. Yeah, it looks good.
All right.
Thank you.
Well, thank you guys so much for your time. I really do appreciate it. I'm going to put you on a brief hold and send you back over to Luke, okay?
Thanks.
Okay.
All right. Thanks, guys. Have a great day.
You too.
How much is the system?
Yes. Right. Seems like it'd be a lot. I know, it's crazy.
The others were like a 5. That seems to be good.
Right?
Thank you for continuing to hold.
Yeah. So, yeah. Even showing that for the chief complaints, X them all, and then actually writes a paragraph for her so that she doesn't have to dictate it all. So, it's pretty easy for her to dictate. Yeah. He was even saying, and it might be something she would want to look into, Apple products, apparently they have voice dictation integrated right in. And it would go right there, right? Is that basically what you're saying?
Yeah, you should.
She
wouldn't
said
need
you could
dragons.
use Dragon
Type.
too.
She has the dragons.
Yeah, but it sounds like if you had the Apple one, I could be wrong. I guess we should have to to ask more about it later if we're going to get it. But you just talk as you're in the chart.
Yeah.
Whereas the
Yeah.
dragon one, she has to
Who's that?
dictate, I think.
Hey, it's Luke again. How was everything?
Hi.
Lou
What's going on? Is it still William and Barbara?
and Susela too.
Okay.
Who's
So
the
how
other-
was everything? I just kind of joined up there as a little bit of a silent partner.
Good. Yeah, everything looked good.
Yes, good.
Good. And in terms of that, I know we've touched on it a little bit. I know William's focusing more on the IT portion, so I guess I would go down the line and say if this, from a user interface and cloud-based solution looks good on your end, William, and obviously the billing aspect for you so far, Barbara,
Yep.
if that, it looks good. Yeah, because I know one big thing, obviously, with the chronic care conditions that you guys know is that posting that we just went over in the demonstration,
Mm-hmm.
which is huge for that patient breakdown, before it's posting instead of working backwards. And that's huge in any office, but even more so with your chronic care condition that you're specifying in. So I think that's a huge benefit in terms of that.
Okay. Just in terms of the, you were saying it's about $500 a month. Does that include all the features we've seen today, like the CCM, or I mean, is there pieces that
Yeah,
we
so
pay extra
that's
for?
in our system, yes. So we do have premium features that you can add on, you can bundle together. You can add them on later. It's all up to you, in terms of that. So that price I gave you, yes, it's got that billing portion in it and everything you saw. But for instance, we also have, that comes with a standard patient portal, that pricing, which is, it's read-only access for patient health information and gives the patient ability to message through it. You can choose where that message goes, provider or, front desk, and they're able to view their history. So, it's like a window and they can message through it. But then the premium patient portal has got a lot more going on. They're able to request refill of meds, request appointments. They can make online payments. They can check in and fill out their medical histories before the visit. Comes with email and text reminders. They're obviously also able to message through that. They can view and edit their patient history, obviously within the bounds that you're allowed to. And then it comes with e-visits, the telemedicine aspect, where they can webcam in from their phone. And another big one, William, that you may agree with on this or you don't need to start out with it, but we also will provide you an HTML script to directly put that premium patient portal on your website or any other landing page, and it gives them another avenue to make payments and do all that with. So that's another kind of point. But if you don't need all those features at first, then you can always add it on later. But having said that, if you do see the value in it, we can always bundle it together at the beginning. Otherwise, everything else, I don't know, is there any other, are you going to need to be electronically prescribing controlled substances?
Not control, but we are able
Yeah,
to electronically
regular e-prescribe,
right?
though.
Yeah.
Okay. So
Is that all inclusive then?
EPCS, sorry, go ahead.
I'm sorry, is that all inclusive, the e-prescription?
Yeah, the e-prescribe through SureScripts is included, and we have just now, it's actually a beautiful time that we talked about too, all upgrades, it's not like hardware, so it's all included with everything, your grandfather in at the rate. So on top of the e-prescribe option that we have available for you, we also have Cover My Meds. That is a layer on top of that, and essentially doing exactly what it says in the title, making sure all authorizations and everything is checked before, so there's no holdup when you're prescribing with any kind of e-prescribing. They're not going there and they're not authorized for it, or it's covering the whole aspect, or it's ready now, or it's not, so they're not waiting there for a day or 24 hours because people need their medication. So it's just another layer of support on that end.
Okay, just to verify, is the CCM part of it a premium feature? That would be extra?
No,
okay.
No. That's all just part of our billing.
Got it.
So what you saw was just part of our PM portion, the billing portion. Yeah, so that's all just, we have a lot of pain management, a lot of that, where there's, people with diabetes, people with follow-up like that, it's all in there. Okay. And not only that, you're also able to really task out, too, in terms of the system, with having people of groups to make sure that you're notified to check up on certain things if they're falling into a certain category, like diabetes, for example.
Okay. And so the EHR plus the billing part of it is approximately $500 a month. We're talking about, right?
Yes, and the only other premium feature is that you can use your own fax machine if you have it and upload into our system completely free of charge. And then we also offer, encrypted faxing e-fax service. On top of that, if you do fax a lot, you could utilize that. We can route your old number, so you don't have to change your number. But if you don't fax that much, it's one of those that I would recommend straying away from for a little bit until you have a page count down, so that we can address that appropriately. Because what you will find is our EHR, it talks, to different EHRs as well as pharmacies, obviously, where you're not dealing with as much faxing as you may have been used to with your previous company.
No, we don't fax that much. Yes.
Okay.
We don't need that.
Sounds good.
Yeah.
So that's not needed either?
So whatever we saw just now is all inclusive, right? The
Yeah,
eligibility.
exactly. Yes.
The phone
The
calls
only
is
thing,
separate.
yeah.
The phone
I'm sorry,
call,
go ahead.
I'm sorry. The phone call reminder, is that separate or is that inclusive?
Yeah, so phone call reminders are something that we have a partnership with
Okay.
Dr. Dial,
Right.
simply because it wouldn't really be fair to bake that into the cost because of a couple of reasons. One, it's statistically known, that having patient reach out is always usually best by, obviously, the practice itself. Otherwise, you're paying for a service and they end up calling you anyways. But the automation of it is nice, and you can always explore that option.
Yeah.
But that would not be included in the price. That would be a partnership that would integrate with us, and they would work with you on that, and they're called Dr. Dial. And then other than that, the only other thing was the premium patient portal or the email and text reminders, which is a premium feature.
No, that's not going to work for us. Email and
Yeah.
text because.
What, the premium patient portal?
Yeah. Not our
Yeah, no,
patients.
that's fine.
elderly.
The standard portal is completely
Yeah, a
fine.
lot
The
of
only
our
other thing I
patients
know.
are speaking Spanish and Portuguese. And so,
Yeah, they need a phone call. So what does
Yeah.
that cost to get the dialer doctor?
So with that on top, it'll range in terms of the services with that, which I can definitely include for you, like an email or however you want to move along. I'm not sure of the timeline for decision making with this or anything like that, because that, for implementation or anything. Do you guys have an idea of when you want to be up and running?
well, I mean, the ideal would be as soon as possible, but obviously the reality is set a little different. So,
Mm-hmm. So what it is I can actually get you in touch, or get you some line items with the different packages that they have for your volume of phone call or reminders and whatnot. And also just going on that $4.99 price. I know data migration's needed too, and William, we touched on this.
right.
If you need a multimedia data migration, it's very pricey. The industry standard is around $3,000 to $5,000. It's usually at about $5,000. And I think we touched base on this. If we do this right with the demos and whatnot, the only way for me to be able to get you out of that charge would be a 3-year agreement. I mean, if you can understand, if you're signing on for 12 months and we're starting a data migration project, I don't have the leeway.
Right,
But,
yeah, that's fair.
36 months is a commitment where it's not like we're extracting your data in the next, 8 months, which is, it's a project to
Right.
get all that stuff in,
Yep.
So, yeah. But, in terms of Dr. Dial, if that's something you're interested in, with partnerships and specific to this, is where that's where I can actually assist with, with the timeline being tight with our pricing. So on that per provider cost, if you're wanting to utilize Dr. Dial and that's a big aspect for you, then that's where I can actually, get it. When we're doing the partnership with Dr. Dial, they'll have, a certain price for you, and then I can actually get a 15% off that $4.99 charge, which you'll be grandfathered into. So,
Okay, great.
even if you stop using the Dr. Dial, it's just to help, mutual beneficial there, 15% off that locks you in there, will help you with the cost on the Dr. Dial. And then also, not that, if you're comfortable with the 36-month contract, the multimedia data migration will go away. And then being if it's, time sensitive and whatnot, with this package, then we can also offer 2 months free. We don't have a setup cost. We talk about that. Everything, our training and implementation is included in the per provider monthly cost. So you would usually be putting that down right away because that's when training and implementation is kicking off.
Right.
Instead, we give you a nice 60 days from effective date just to get the ball rolling. And all meanwhile, your training's already getting set up. You're getting a login and password. You're playing around with the system and everything like that.
Okay. Sounds good.
But I think we checked all the boxes with everything that you saw is what you want. The only other feature is the data migration, which we're aware of that, and then the doctor dial aspect. So all I need to know is if you like the system and everything looks good and the price point's right, what would be my next best steps to, follow up with you or, meet the timeline of, making
Well,
a decision?
I guess you and I, or you and, or myself and whomever your data person is, we should get in touch, and then I need to get in touch with them, the office, and then at least find out for sure whether that's going to work out or not. That would be a very important thing to know before we.
What if the migration will work out?
Yeah.
Yeah. So first and foremost, don't put all your cards down right away, so they don't. You know what I mean? If you're talking to a sales rep, obviously, over there. Because I can look into Med Office too and just check the history on our end.
Yeah, definitely do that for me. Yeah,
I can do that because what we do is the feasibility call when we're taking it off your hands is when you're a client. But what I can do before that is obviously just check the history with them because then that's going to be, we've done it before, so no issues.
Yeah, that would be perfect. Yeah.
And I can take that off your plate. But in terms of that, if everything's looking good and the price point and whatnot, what would be the next step needed to move anything forward? Cause,
yeah. Why don't we, we're going to want to have the doctor take a look at this video, and then why don't we just have another call at the beginning of next week, and then we can, I'll hopefully get some feedback from the doctor.
I gotta go.
Okay.
Okay.
We have this video.
So you want me to give you a call on that number that I have here on Monday of next week?
Mondays is usually bad for me. Tuesday morning would be fine, or Tuesday, anytime Tuesday.
Okay, so I'll put it down to follow up on Tuesday, and then I'll make sure I can shoot you an email, and obviously we're going to be talking on Tuesday, but to just document everything we went over discount wise.
Right, and so if you could facilitate that MD office thing, that would actually clear
easy.
something off my plate. So.
No, that's a very easy task for us to do.
Good.
Because we're doing this all the time. All I have to do is walk over. We're all under one roof and go talk to them and say how many times have we done it with MD Office.
Perfect.
Yeah, so no problem on that. I'll take care of that, and then we'll talk Tuesday. And if everything looks good, let me know. Keep me involved. Any questions going forward, and I can definitely lock that in with everything we discussed.
Yeah, very good. I appreciate your help.
No, I appreciate you, William, and I'll let you know on the MD Office thing too as well, okay?
Okay, take care.
All right. Bye.
What's not to like?